Hi, I'm Dr. Michael Ritchie, and I want to thank you for joining us for this segment. We're here at the optical shop at the Eye Clinic, and I'm joined by Gail Katerlich. Gail is our clinic administrator, but prior to that, Gail spent most of her career as an optician. She was our lead optician for years before taking over the administrative duties. What we'd like to do today, Gail, is learn a little bit from you about how we go about picking a frame. Now, there are many aspects of picking out a frame that most people don't realize. And I know, as you've said, some people come in and say, oh, I dread it. I hate picking out a frame. I don't know what I'm doing. Gail, help us.
Okay. And that always surprises me because myself and the opticians at Ritchie Eye Clinic love to pick out frames, not only for ourselves, but more importantly for our patients. And I think the thing is, we've got a lot of frames in here, and it's probably overwhelming for them. So what we love to do is to take and sit down with our patients and talk about what their needs are, what their prescription is, look at what they've liked in the past, and then talk to them about what we can do to narrow down so it doesn't seem so overwhelming.
So let's start with me.
Okay.
I'm your patient. I've had my frames for 2 years. I need new frames, Gail.
A lot of times what I start with is, what have you liked or not liked about your current pair of glasses?
Okay, I like the way these feel.
Okay.
They fit my face nicely, I think. I can't see them, so I don't know how they look, but they feel comfortable. So I probably don't want to deviate too much from what I've got. But I'd like something new. I'd like a new look.
Good. I was going to say, most men tend to not like to go way far away from what they currently have. So it's funny how when you say you don't like to do something too different, it's always a male thing. I don't know what it is, but
Okay.
It's a good thing. Now, having said that, so you've got, what we look for is the right fit. It is so important to make sure that frame fits you well, not only because of how it looks, but how it's going to work with your prescription and how you're going to see. Now, I'm going to purposely put this one on and show you what an oversized frame would look like on Dr. Ritchie. Now, he could get by with this. Number one, it probably ages him. It's not age appropriate for him. Feels totally different.
Feels totally
than what,
different.
Yeah.
It sits differently on my face and on my nose. But more importantly, and I even know this part, I have a fairly strong prescription. So the bigger the frame, the bigger the lens, the thicker the lens with my prescription. So this is going to turn out to be a very heavy pair of glasses for me, even with light, high technology, high index plastic lenses.
Correct. So, that's kind of an exaggeration of what not to wear. Here we're going to go down to a smaller frame.
This is almost like an erector set.
It is with the new. There are so many different styles from
Ew.
when people want, and you can feel they're going to be tightened here, not going to give him the optimal space to utilize his prescription. And you know how many times people come in, we take their glasses off, and they are grooved inside the head.
So indentations along the
Right.
temple.
When you've got indentations, a lot of people think if that's how it fits, that it's going to be tight and it's not going to move. Actually, the opposite is true. It actually pushes its way forward. So having the right fit, having the optician say, let's open that up. It's fine to have a little pressure back here, but it shouldn't be that feeling you take your glasses off and you go, oh, it feels so good when they're off. You
So
shouldn't
this, in
even
fact,
bother.
is a frame that's too small.
Too small. Now, so we look at something like this. Here is something, if you want something to disappear on you, try this. This is one of our, Silhouette is a wonderful company that gives us a lot of options in the barely there look. For people that maybe don't have the option of wearing contacts, this is what we love to go to because they say, you know what, I want something that just disappears on. You put an anti-reflective coating on that glass, and now it looks like you don't have glasses on. More importantly, you probably don't feel like you've got glasses on, but it's a very nice look, a very updated style. And the nice thing is, you won't look like everyone else because this company has a lot of different temples that really customize your look. You can go different lens stylings. We'll
Now,
put
I
this
did.
one on.
I did spend years in Silhouette frames, so I'm very comfortable with this frame. It does basically disappear. This is one where when you put it on, if the nose pads are fit correctly, it will rest on your nose and you will not know you're wearing them.
Very comfortable.
They're very comfortable frames. The drawback Well, actually, that doesn't happen anymore. In the days when I had mine, you needed two hands to put them on because the bows curled over. So you couldn't put them on with one hand. The new design has fixed that.
They listen to the public, and there's a lot of
this
imitators, but really only Silhouette's the one we use. You know, we tend to go with the companies that not only perform well but stand behind their product, because we want to serve the public. And if it doesn't fit you right or doesn't work with you, we work with the company to make sure that you're satisfied and that you're happy with your new pair of glasses.
Great.
Let's now go to something that gives you a little more of a look, has a full frame, but again, we're talking about flat metals. Almost looks like a plastic frame because it has a little bit more temple to it. But when put on, especially for the men, it has a really nice look. And that frame fits you well. So we look at, as an optician, I look at you, your eyes center nice. We have enough depth. It used to be if you were into the progressive or the bifocal age, which I'm there with you, so I can say that to you. We would have to go with a bigger lens. That is not true any longer because we've got new technology in lenses that make something like this very wearable, very comfortable to use your progressive lens with.
So with new bifocal technology, we can go with a thinner lens this way and still get the full range of the bifocal. The progressive bifocal technology has advanced to the point where we can fit it into a smaller lens and people don't get the whooshing feeling that we used to get.
We always say, you know,
This frame is a little bit more, probably a little bit more update than I've ever gone.
So let's then, this happens to be the next frame that you will be seeing Dr. Ritchie wear. Us opticians search far and wide to find, every so often we put a pile of new frames on for him, because as I say, we love to try different things.
So I get new frames whenever they tell me I get new frames.
It's time. And also the fact that why wouldn't you have more than one pair of glasses? You know, one of the things that surprises me is, especially for us women, we tend to have how many pairs of shoes? And the one story that stands out is I had a mother of the bride that came in and she said, you know what, I spent so much money on my dress, on my shoes, and what I didn't do is I didn't update my glasses. And in every picture, all I see is my old glasses. You know, think about when people come and talk to you, what's the first thing they do? They look at you, they look at your eyes, and there's the frame. Just as the right frame around a photograph makes that picture pop, the right frame on your face lets you shine through, but also makes a statement of kind of who you are. There's a personality that can come through.
You'll notice on this one, I'm wearing a red shirt, red tie, but the frame is green. So that may not be the ideal combination for me. Now, it just so happens that my current frame,
Which you, of course, would have normally put those in a case, right?
I would have, has a little bit of a reddish tint to the bow, which actually fits with my outfit today. Keep in mind, I'm not notoriously fashionable, so I don't have several frames at home to switch from one, to switch at the frame according to my outfit. But we have several people who do. Mm-hmm. And people will be concerned about, gee, if I have that many frames, what if my prescription changes? Once we hit normal adult life, you're through your college years, you're through your mid-20s, you hit 30 or so, your glasses prescription isn't going to change. So if you want to have multiple pairs and acquire them over years, the prescription is basically going to be the same. So you can do that. And we do have a number of people who have 3 or 4 or 5 different frames to go with different outfits and just get a few different basic color patterns.
We also have, you buy one frame, the second pair there's a discount. So we always work with you to make sure that you can have some more selections, because it's important that you feel good in what you're wearing.
So Gail, tell us about sunglasses.
Sunglasses, so important, not only for taking and protecting your eyes, but also for your vision. It's funny, I depend more on my sunglasses than I sometimes do in my regular indoor pair, because when you're driving, if you have a good pair of polarized lenses, you can see things so much more clearly. And and just the relaxation that it does on your eyes. You know, we do have a skincare clinic. The wrinkles that it gets from squinting, take care of your skin and your eyes. We want to watch out for the fact that it covers enough. You know, the sun comes like here. If you have a pair of frames that sits too low, you're going to get the overhead. Keep in mind where the sun's hitting you and what bothers you. So a good pair of sunglasses. Polarized is important. You can go with the plastic. The other thing that when people go, you know what, I don't like something sit in my face, then let's look at something with the nose pad. Also, flex hinges for those people that sometimes think that it gives them too much of a binding. Very flexible, comfortable, many different pairs to choose from. It gives you a great look, and it's not just for summer. It's a year-round thing. Snow is terrible, but here we are at springtime, time for a new set of glasses. We have clip-ons for people that don't necessarily want to go with a full pair of sunglasses,
But I will jump in here and tell you that we do have clip-ons. They are not going to be the same quality, and they're not going to give you the same vision as a full prescription sunglass. When we talk about sunglasses here, we are so confident in prescription sunglasses that we offer a full 100% unconditional money-back guarantee. If you don't like them, we'll take them back. And as of yet, we've never had anybody bring a pair back. That's how happy you'll be with prescription sunglasses. Gail, thank you much for your help. I appreciate the information. You've actually taught me a few things about glasses and frames that I didn't know.
wonderful. We'll help you look and see your best.